Hello everyone, I am urologist Omar Erdamakaya. Today I will talk about the chronic prostatitis patient group. They are an unfortunate patient group. Why an unfortunate patient group? I remember even from my residency period, I am speaking for the whole world, frankly. While we were dealing intensively with cancer surgeries, prostate cancer, kidney cancer or stone surgeries or prostate enlargement surgeries, chronic prostatitis patients were a bit overlooked. It was an unfortunate group, because the exact cause of the disease is not clear and there is no complete treatment. They have conditions and rules. Treatment protocols and treatment guidelines are limited. And the level of evidence for treatment protocols and the treatment guidelines needs to be quite high, so that it can be included in the treatment guidelines. That's why you cannot do any treatment you want under university conditions. But it was like that not only for Turkey but also for the world. What were we doing when chronic prostatitis patients came? We were giving antibiotics, painkillers. Or we were doing cystoscopy, or we were trying to treat and follow the patient with medication. Of course, patients were traveling from doctor to doctor afterwards. In the following time, my assistantship ended. What did I do after I got my specialization? I tried to improve myself in these fields. I tried to follow the current literature, current scientific publications. I tried to learn what is being done about these in the world. Of course, years passed. Now I am much better equipped to deal with a chronic prostatitis patient, because after a certain period of time, you start to specialize in branches in the profession. I try to apply many treatment protocols at once in chronic prostatitis patients. Because chronic prostatitis patients are not very standardized. Normally, according to our treatment guidelines, chronic prostatitis is divided into 4 categories. But even this classification is constantly changing. Some patients have infections in their reproductive cultures, some do not. Although not, their complaints may be high. Some may have had intercourse before. Some may have never had intercourse before. We try to recover by doing many treatment protocols. What do we do? First, I give a prostate massage treatment. I do the prostate massage myself. Prostate massage is very different from prostate examination. It is actually done with both hands. It is not done with one hand. The patient is grasped with one hand. He is also pulled. The prostate is compressed with the other hand. You squeeze it between both hands. And in prostate massage, we do not pull the hand immediately after pressing the prostate. We wait for it to be empty and we apply the procedure just as the tracing of the ducts. From outside to inside, from top to bottom. Patients can do prostate massage if they feel relaxed on their own. But as I said, there is a big difference between a urologist doing it and the patient doing it on his own. In a very important part of the patients, a state of well-being occurs after 3 or 4 sessions of prostate massage. Patients' complaints about sexuality and erection, especially at first, and then their complaints about pain and urination, become better and recover. The patient's mood improves. Because this chronic prostatitis disease is a disease that turns the patient's psychology upside down and forces him to change the decisions he makes in his life. As I said, it can affect the patient's whole life. It can affect everything from marriage to work. For example, there was a student patient. He cannot go to and from school. He has to urinate constantly. He gets burns and so on. The child took a break from school for a year. Then he started again. We treated him in the meantime. Urination times have become quite long. It went up to 1.5 to 2 hours. He was urinating every 15 minutes. He had burning or something like that. He had sexual dysfunction. Police friends may have chronic prostatitis also. When you look at it, they have a lot of complaints. Police officers can work outdoors in cold areas. And of course, their complaints about prostatitis start to increase. Again, there are soldiers who have complaints about chronic prostatitis. They work outdoors. They stay in the cold. We have patients with a sexual history. For example, one of our patients who came today describes complaints about chronic prostatitis, but his story actually starts 5 years ago. When I questioned a little bit, I think he himself did not realize that these complaints had started before. But in fact, his complaints started a few years ago, and he had an active sex life. In general, as I said, it is necessary to evaluate patients as a whole, and perform many treatment protocols at the same time. Thank you for listening.